Welcome back to the National Citizens Inquiry as we continue with our hearings on day one in Edmonton. Commissioners, the next witness we're calling is Faith Groleau. Faith, can you hear me?
I can, yes.
Okay. And can you speak up a little bit? You were a little quiet there.
Absolutely. Are you able to hear me better?
Yes, that's much better. Faith, can you state your full name for the record and spell your last name for the record?
Faith Danielle Joyce Jane Groleau. My last name is Groleau.
And Faith, do you promise to tell the truth? Do you swear to tell the truth, the whole truth, and nothing but the truth? So help you God.
I do, sir.
Now, you were transitioned from a female to a male when you were a teenager.
Correct.
How old are you today?
25.
25, okay. And you're here to tell us about that journey, but it actually starts with a medical problem when you're very young. Can you tell us about that and then just kind of walk us through your story?
Absolutely. I was born with a diaphragmatic hernia. There was a hole in my diaphragm. My intestines went up into my chest wall and they had to be brought down, and that hole needed to be repaired. It was repaired when I was about 4 days old. When I was about 5 or 6, there was actually a complication, which is a very known complication with this disorder. The patch ripped off because 5 or 6 years old I was growing, and that patch doesn't grow with you because it's metal mesh. So that patch ripped, the hole reopened. I went to several doctors over the better part of 20 years. I would tell them all of this, and none of them could find it. None of them could tell me why I was in excruciating pain when I would eat or have to pass anything from the digestive tract. It would have to essentially go up through the hole into my chest wall, come back down, and it would move my ribs and my diaphragm around because of the hole there. And my intestines had gone back up into my chest when I was about 5 or 6. So for about 18 years, that was an issue. And I was repeatedly going to the emergency room and seeing family doctors, and none of them could tell me what was wrong. So I ended up just kind of living that way. Around 15 years old, I had a lot of mental health issues growing up, and by 15 and 16, I started getting diagnosed with those and actually getting some better treatment for my mental health problems, but still never finding the physical problem. By about 16, 17, I was actually seeing a physician for gender dysphoria and for feeling uncomfortable in my female body. Which all of that was just kind of tied to different mental health issues. There was a doctor I saw at about 16, 17 who agreed with me that I could diagnose myself as transgender and that I had gender dysphoria. So I went on the medical path because of this doctor, and I was given puberty blockers and testosterone. By 17 years old.
Can I just slow you down there a little bit, Faith? So, because you had mentioned when you're sharing your story with us, you know, you had some other challenges, and I don't, because it's not necessary for us to say who or give any details, but my understanding is when you were very young, you were sexually assaulted. Like, so there's some trauma here from sexual assaults as a young child. Is that right?
That is correct, yes. And the doctors were aware of that.
Right, okay. And then as I understand it also, you got a fair amount of bullying in your school when you were younger for a couple of reasons. One, you were short, and then, there were some other reasons, like kids can be cruel, but you would actually become aggressive just to protect yourself.
That's correct.
Okay. So now when you were starting to talk about what was happening when you were 15, you're actually blacking out at that time, right?
Yes.
Can you share with the commissioners exactly what that's like? Because that's a statement, but they may not understand the experience and kind of the problems that you had to live through because of that.
Of course. Essentially, because of my mental health disorder, whenever I would experience physical or emotional pain, if I got made fun of and felt upset, or if I got physically hurt, I would black out and my conscious mind would go somewhere else. Something else would take over, and I wouldn't have memory of that time. Sometimes people would come up to me and say, oh, we had a conversation, I saw you here, and I wouldn't remember seeing them, I wouldn't remember the conversation, wouldn't remember going to the places. If you're trying to learn in school, sometimes you try to go for a test and you can't get the information because it's just not there. You don't remember learning it. You don't remember being in the class. And just I would have holes in my memory constantly while trying to navigate the difficulties of life in general, but being a teenager specifically. You know, everything's changing and being different than you're used to, and you have to adapt with that. But if you don't remember some of what was, you don't remember what changed, you know, that can be extremely damaging to try and get through, honestly.
It sounds like it'd be absolutely confusing because you wouldn't know what you've done with some things. And I'm just trying to kind of create a narrative so that people understand kind of where you were mentally and physically when you were transitioned. So you have a history of real trauma on two fronts. So when we were talking about you being bullied, like we're not talking minor bullying, we're talking this was a significant issue. Is that right?
Correct.
And then also, you know, some pretty serious sexual abuse when you were a child.
Correct.
And now add on that, you're literally having blackouts. And then at age 15, you were diagnosed with what's called basically it's multiple personality disorder.
Correct, yeah, dissociative identity disorder is what they call it.
And what was that like to experience?
My mom was actually very religious and was very afraid of that diagnosis. Friends were trying to be comforting, and no 15, 16-year-old kid really knows how to deal with someone like that. You feel like you're this monster, you know? There's something wrong with you, and you don't always know who you are or where you are or what day it is or what year it is. That's always the fun one. And then you're trying to have relationships with people, whether they're friends or not, and you can't function that way. And to constantly have to explain to people why you're like that, that's just, it's extremely isolating and again, very confusing, just the fact that, you know, people don't like you or don't really get along with you, and you don't entirely understand why, because you're not doing it intentionally. And it was a very long struggle to try and really get people to understand what it was, for me to understand what it was. And even with that, I mean, I don't really, like, I don't talk about it very often. I had to in school because I needed to let my teachers know that, hey, if I don't remember things, this is why. But yeah, it's extremely isolating when you're diagnosed with something that people don't really understand, and the only treatment you really have is to give it time and to try and stay present, which is difficult for anyone. Yeah, it was rather uncomfortable, for sure.
Okay, and you were diagnosed with that when you're 15. You're also diagnosed with post-traumatic stress disorder when you're 15. Am I right about that?
Correct.
And what was your experience with that?
It explained a lot of the difficulties I was having. Like with post-traumatic stress disorder, you get flashbacks of trauma, and so sometimes I would see things and hear things that I may not even remember happened because of the blackouts. but it feels extremely vivid and real. It's like a really bad daydream, but you can't stop it or get out of it. You have no control over it. There's also the anxiety that comes with it, just in the sense of like, you're constantly hypervigilant about, I'm in danger, I need to know how to keep myself safe at all times. And if you're going through that, you're always in fight or flight. You're never relaxing. There's not really downtime for you. You also get sleep problems with post-traumatic stress sometimes, and nightmares. Nightmares are not fun. And so sleep isn't restful, and then you have to go back to school when you're already not sleeping well and try to learn. And then you have these horrendous flashbacks of things that you don't entirely remember. All of it is just a lot. And again, like the best treatment they can really give you is, here are some exercises to try to stay in the moment and to remind yourself that you're not there anymore. Give it time, and that's it. Because when you're young, they can't really give you a lot of medications that are safe for that, and even the medications they can give you are also not entirely safe when you're that young. So all of it was just a conglomerate of lots of confusing things and different diagnoses and things I had to try to keep myself regulated as I could.
And then when you turn 16, you're diagnosed with both depression and anxiety on top of these other two things. Is that right?
Correct.
Now, at the same time, and just we've had some dialogue, and you strike me as a researcher. Just so that even the commissioners and public know what I mean. So we've marked as exhibits materials that Faith has sent. So there's the WPATH documents. There's the CAS reports from the UK. There's a study on mastectomy. There's a National Post story that's of some significance. These are marked as exhibits E4, E5, E6, and E7. But it's just you're a researcher. And I'm just bringing this up because while you're getting all these diagnoses, you start researching gender transition. And so tell us what happens. So you're in this mindset where you're dealing with all these diagnoses. What do you do with regards to gender identity?
Around the times I was getting these diagnoses, there was a show that came on called I Am Jazz. And Jazz Jennings is an individual who was transitioned at a very young age, younger than I was, and went through the surgeries as well as the hormones. So even went further down the path as I did. This journey for Jazz was all televised. It was a reality show. As far as I know, family gets the money, and Jazz is essentially put on as this poster child for transgenderism at the time. And if something is televised, being done by doctors, again on television, you're going to assume as a 15-year-old that, oh, well, these procedures are fine. It wouldn't be on TV if it wasn't. And so I had every confidence that it was a medical procedure that was normal and was fine. So I started looking into that myself and looked at the surgeries. I looked at the hormones I would be taking. I looked at where some of these people come from, like why you end up thinking you're the other gender. And I looked into all of this, and a lot of it still seemed to ring true for me, just in the sense that gender dysphoria is you're very uncomfortable with your gender and everything that goes along with that. And so I ended up kind of bringing these options to the attention of my therapist. So I was able to find some resources locally, like a gender-affirming group, essentially. And throughout that, there was a point where I had a very bad night. I was very suicidal, and I asked my mom to bring me to the hospital. And through the emergency clinic, because I was suicidal, the doctors assumed it was because I was gender dysphoric. And so they fast-tracked me into the gender clinic that we had here. And with that, I was fast-tracked. I believe I started seeing the physician in March of 2017. And by May, I was on puberty blockers. By October 2017...
And I'll just slow you down. You're 16 at that time, right?
Correct.
And your mother has basically rushed you to the hospital because you were suicidal and you needed to be protected from killing yourself. Am I right about this?
Correct.
And in that context, they decide to fast track you to gender transition, and in a short period of time, you're on puberty blockers.
Correct.
But what can you tell us about these puberty blockers before you go on with your story?
Puberty blockers essentially, for me personally, because I am a girl, they stopped my puberty going that direction. So I went into menopause essentially. Because I was 16, 17, I had started puberty, and they actually stopped it partway through because of the drugs. So the puberty blockers are supposed to go before you start puberty, but because I was partway through, I went into early onset menopause and now have incontinence issues. Pelvic floor gets weakened because of that. Going into it is one thing, but I've also now come out of it because of detransitioning, so that does a number on your body. During puberty, your body is craving a specific hormone, and if you don't get that hormone, if it is synthetic, if it's the wrong hormone, your body does not complete puberty. So I'm still having to complete it now at 25, where I should have already been through it for the past few years. I went into puberty, or into menopause, and everything essentially stopped and slowed that. And then because of the cross-sex hormone, I ended up having the wrong development. And so now that it's stopped, I have to essentially go through and redo everything. But I can't, because you can't go back and get the time again, and so it's a whole mess. But things don't fuse properly. During puberty, if you're not getting the correct hormones, like my spinal column may not have fused properly, my cervical spine as well, my neck, like you can have all of these different problems depending on how long you're on it. I was very fortunate. My problems were not that bad. There are people who have them significantly worse.
Can I just slow you down so people understand, Faith, what you're saying is it's not just that you develop sexually in puberty, you grow. This is what you're talking about. And so am I correct? Like basically your joints didn't grow properly and you have severe joint pain.
Correct.
And when you're talking about your back, it's literally it didn't grow properly because you interfered with this puberty growth cycle in your skeletal system.
Exactly.
Did anyone tell you about that?
No.
Okay.
They
So
said puberty blockers were reversible and that they were like a pause button. They did say some of the things with testosterone was permanent, but they didn't say anything about the puberty blockers.
right, okay. So you had no idea the damage that you were going to do to yourself.
No.
So, okay, now you were starting to tell us, so you started taking male testosterone and it caused you to develop in a different way. What happened there?
Correct. So with the testosterone, for one, it's synthetic testosterone rather than natural. So that also will make you develop differently than if it was natural because it's absorbed differently. Testosterone can give you liver problems, especially if you're a woman taking it because it's not designed for you. With the respect to the changes that are expected, females will have clitoral growth, they will have voice dropping, basically a couple of octaves, sometimes not, but the voice drop is permanent. Body growth hair, facial hair growth will grow more like a male pattern than it will female. You'll have coarser and thicker hair. You can get male pattern baldness depending on your genetics. And again, it just does a lot of damage to the organs in general because it's not something that's designed for our bodies to take it. It's designed for a male body to take that, which is already predetermined for the testosterone. With us, you're essentially forcing it to take something it's not designed for.
Now, you say some of this is permanent, so am I correct that you still have to shave even though you're no longer taking testosterone?
Correct.
I just want to back up and switch gears a little bit because I'm curious. how hard it was for you to convince the doctors to be able to do this, because here you've got severe childhood trauma. You actually are, blocking out where you're confused about your own life because of a medical problem where you don't have a straight memory. You've got multiple personality disorder. You've got PTSD. You've got depression. You've got anxiety. You've just been taken to the hospital because you're suicidal. So I imagine it was really, really hard for you to convince them to transition you, because they'd be so concerned about all these co-conditions and wanting to make sure that you weren't just making a bad decision. Can you tell us about how difficult it was for you to do this, convince the doctors?
Not at all, sir. I didn't have to convince them at all, actually. I was essentially able to walk in and say, I think I'm trans. Could you help me? And they didn't really even question it. They just they asked me questions about why I thought I was trans, but they didn't question me or my diagnosis. They literally just kind of said, yep, I think you are too. Okay, let's get you started. And I had issues with my mother because she was extremely religious, was not entirely fond of the idea of me transitioning. And the doctors actually were more concerned about kind of convincing her that this was okay, rather than they were about questioning me and why I thought I might be trans. They were fine with me just diagnosing myself, incorrectly, mind you. But yeah, I didn't have to convince them at all.
Right. And then you were actually approved for a surgery, and you didn't go through with it. What happened? How did you come about changing your mind about transitioning?
So with the surgery itself, I was approved for top surgery, and that would have been a double mastectomy. And OHIP would have covered the glandular tissue and the fat tissue removal, but they would not cover the nipple grafting and extra contouring, essentially, to make me look more masculine. And I, at the time, couldn't afford it because I was 17, 18, and didn't have a steady enough job to afford thousands of dollars worth of plastic surgery. So I just let it expire and stopped pursuing the surgery. I was still on the hormones. I was on testosterone, not on puberty blockers, for a couple of years. And then I eventually did stop everything on my own. And then the WPATH files came out last year. And once I started looking into those and kind of looking at WPATH as an organization, looking at the journey of transgenderism essentially as a whole, it really made me realize that my doctors don't know what they're doing, and they didn't with me. Per my physician's own admission, I also submitted a complaint to the College of Physicians and Surgeons about her, and in her answer while she's being investigated, she states that she didn't know that I had other mental health issues, but in her notes, which are in my medical records, which I have, she clearly states somewhere along the line that she has a record of me having these other mental health issues. So she lied to the college while being investigated, but also in her own record knows that I have these other issues and still just let me transition with no question.
You've just raised something really important. So actually, it's in your medical records that the doctor approving your transition understood all of your pre-diagnoses, and yet you've been quite clear those were completely ignored. Am I getting that right?
Absolutely.
And you also raised something really interesting is, so, they were willing to basically remove your female breasts so that from a sex perspective, you don't have female breasts. But that surgery would just leave your chest a total disfigured mess with scarring. They don't actually make it so that you would look good as a man. They don't pay for that.
Correct.
So does everyone know that? Do we have basically, young females going in for this surgery that come out disfigured because they don't know that all they're doing is removing the sexual part of their breasts?
Yeah, I'm not sure how much conversation happens actually with these surgeons. in my own personal experience, I did have surgery a couple of years ago to finally repair that complication. And my surgeon actually didn't communicate with me very well what the scar would look like. And this is life-saving surgery. This isn't just a cosmetic thing. And the scar turned out differently than what he initially told me. If this is the case with the plastic surgeons as well, where they're promising these kids, you're going to look this way, and they're coming out of it looking completely botched or nothing like they were promised, that's bad. But some of these kids are even told, like, hey, we won't cover your nipple grafts. Are you okay if we just don't give you nipples? And so then you have young girls walking around with no nipples. They do this with the genital surgeries as well, where they will have nullification surgeries. I'm not sure how much is communicated to these people. I believe that they're told by the surgeons what's going to happen. But if they're not, then they're just going blind, and they're not informed at all of what they're going to look like afterwards.
I want to switch back to the harm that was done to you with the puberty blockers and then this testosterone. Do you know yet whether or not you are sterile?
No. So I presume that I am still fertile because I still get a period. But that won't be clear until I do attempt to have children of my own. And if there are complications, then it will be assumed that it was because of the transition and the drugs I was given.
No, the topic of these hearings are children safe? And so I'm going to ask you that question because you're and obviously in relation to gender identity and transitioning, because you've got a unique experience. So how would you answer the question, are children safe?
Absolutely not. No. Children are not informed properly. The parents aren't properly informed. My mother was completely emotionally blackmailed into letting me get a procedure and drugs that I didn't need. And this was for a completely mental thing. It was not a physical problem that I was having in terms of why I was transitioned. And yet they still coerced my mother into allowing this dangerous procedure to happen. There haven't been clinical trials, so there is no real evidence for them to go off of that these procedures are actually helpful. And if they're willing to coerce parents into giving these children experimental procedures on things that they really don't need based off of the children's feelings, they're not safe at all with anything. These doctors aren't being taught at all. And then they have teachers pushing this information in schools, and the kids have no idea that these things will lead them down a medical path of being medicalized for their entire lives. They don't know that. There's no way for them to know that.
Can I inquire further? You were mentioning that your mother was coerced into allowing you to do this. Can you share with us what your observations were of that?
Because I was 16, my mother was told that her signature was not required. It was simply encouraged so that it would show me that she was being supportive. The doctors completely weaponized my suicidal ideation and any other mental health issue that they might have been aware of or not. And they essentially told her, if we don't give your kid these drugs, if we don't cut your children up, they'll kill themselves. But what they don't tell her is that the drugs can also kill me, the surgeries themselves and the complications that come from that could also have killed me. They don't tell me or her that. But they completely tell her that I'll kill myself if I don't get drugs. And that's just, I don't believe that's fair at all to weaponize the empathy and the maternal care of a parent like that. That's just ridiculous.
And when we were having a conversation the other day, you said something very interesting to me. You said there really are no safeguards in the medical system because it's an affirmation-only model. And I think it's really important for you to understand to this inquiry what your statement means.
Mm-hmm. Essentially, with going in, when I had the medical complication when I was about 5 or 6, I walked in and told these doctors, I was born with a problem. I think the patch ripped off. Could you fix it? And for almost 20 years, they couldn't find an issue that I was spoon feeding to them. Yet I could walk in at 16, say, I feel this way, and they were perfectly fine to give me whatever treatment I wanted, without proper investigation and without doing any sort of cognitive assessment to make sure I was even mentally fit to make these decisions. There's absolutely no way that children are going to be safeguarded in a system that works that way, because the doctor's hands are tied at that point. They're not allowed to question the child in terms of why they feel a certain way and tell them, well, maybe you're not that, maybe you have something else. They're not allowed to say that for fear that they'll lose their license for being transphobic. But then there's also incentive from the people who make the chemicals that, you know, they're being told as doctors that what you're giving these kids is fine, because they're being lied to by the people who make the medications. And there's not enough objective information and evidence-based information going around about this that's actually showing any of it safe, yet they're still going through with it. And that's just, I don't understand how there's no safeguarding at that point with this.
What do you think the minimum age should be before somebody should be able to consent to gender transitioning?
People are saying 16 to 18, but if you look at any expert who goes into brain development, they'll tell you that the decision-making part of your brain is not fully developed until you're 25. And that only counts if you're not doing any sort of drugs beforehand, because then that will delay it. So at that point, 25 would be the thing. But even with that, my brain isn't fully developed now because it got stunted. And so we couldn't even use 25 as the age. Because even there's an individual who was in their 40s who made this decision and has now been hurt by the complications. There's no real age there, but it's certainly for adults at least, you know.
Right, okay. Thank you, Faith. I'll ask the commissioners if they have any questions for you.
Yes.
Dave, thank you very much for your story and for being so frank and open about it. I used to be a doctor in a previous life, I'm sorry to say. It was beaten into me at a very early age that it was my responsibility, my ethical responsibility, to do what was best for the patient, even if sometimes the patient wanted something else to be done. Do you think that the doctors who looked after you during all of this procedure and process really had your best interests at heart? And if you don't think that, what do you think their motivation was?
Thank you very much for hearing me today. As far as I can tell, no, they weren't looking out for my best interest at all. Certainly not as a young kid and not holistically as a patient of theirs. There wasn't really any way they had my best interest involved. Essentially because if it was my best interest, they would have done a cognitive assessment and they would have had proper research done on what they were attempting to give me. They would have known about the puberty blockers, they would have known about the harm that's caused by them, all of this, because that was openly available online. It was just, I was listening to the doctors instead of the information online at that point.
So what do you think was motivating them?
I honestly can't speak for that because I always want to assume it's ignorance or incompetence. You know, like I would always rather presume the best of people. If I had to say one of the worser ones, financial gain is a big one. Some people can also be motivated by the sheer advancement of science. You know, it's a new surgery that people aren't too aware of. And if we get more kids, then, you know, that can be the version of clinical trials. Because again, there haven't been clinical trials for this. These are the clinical trials, but they're biased and they're not ethical experiments. They're government-funded child experimentation at this point, unfortunately. So medical advancement could certainly be a pretty big motivator for that, I believe.
Do you think maybe there was an element of path of least resistance?
Mm-hmm. Oh, absolutely. With all of the, every side puts pressure on the doctors and on the science and evidence, and especially if you want to have your health care done right away, it's easier to just give the kid a lollipop and say, here you go, than it is to say you use the candy. You know, I completely understand that, but in terms of being a physician at that, with the patient's best interest supposedly being at the heart of it, that cannot be your motivation at that point. But yeah, it certainly could be in this one.
Thank you very much.
Thank you.
I have
You want? Yeah, go ahead. Sure.
faith. The question was asked to you, what would be the minimum age? But my question is, considering all the side effects of this, like treatments, of those treatments, and considering the ideology behind it, that people who has dysphoria, they are not born in the good body, but we cannot say to a black person she wasn't born in the right body, or we cannot say to an handicapped person that she wasn't born in the right body. That's like a big illusion to think like that. Should we continue to offer this procedure at all?
I mean, I'm not an expert and I can't speak to everyone because I am aware of some trans individuals who are still aware of their biology. They just happen to feel more comfortable with the procedures that they choose to get. That being the case, they go through years of therapy where they make sure that this is going to be the right option for them and all of that. To fast track it the way they're doing it right now, no. Absolutely not. That has to be brought into question, absolutely. But to take it away completely from people that believe it will help them, I can't speak to that. But I certainly believe there should be quite a bit more investigative efforts into figuring out what these procedures actually do to people and how they affect people mentally, and how people are chosen as good or not good candidates for it. That would certainly have to be looked at more. I think it's definitely more of a vetting issue. And to simply just say no one can do it, I'm not the one to speak on that, but yeah.
Okay. So my last question is, after having gone through all of this with all the issues you already had, how do you cope with this today?
Speaking out has been very helpful and very reassuring to know that I'm at least attempting to do something and to bring more awareness to it. Because I do believe it's just a flaw in the medical system itself. Had the physical problem I was born with been caught earlier on, I may not have been transitioned. Ideally, doctors will be more educated on things, more objectively educated, not taught certain ideologies. You know, looking at things a little more holistically would be ideal, I believe. But with me, I just find things that keep me busy. Animals are a big thing for me. I enjoy animals and helping them where I can. Most of mine are rescues. And I've surrounded myself with some incredible people who didn't care what gender I was. They cared more about my character as a person. And so me transitioning or detransitioning didn't really make a huge deal to them because they just liked me for myself. and building a better relationship with my family that I do still have. That's been a huge thing as well, and just being able to be open with them about all of this and about the questions I had and what happened. That's been very helpful.
Do you think you would have transitioned if you would have not been exposed to this ideology?
Not being exposed to it at all, probably not, no. The fact that I found it on my own through TV was a little iffy there, but had a teacher like actually been in school and teaching me about it, that would have made it worse completely. So yeah, I don't think I would have if I hadn't found it, no.
Okay, thank you.
Yes, thank you, Faith, for sharing your thoughts on this very difficult subject. I, for one, am very glad that it's good for you to be able to speak out and know that you have an audience that's very interested in your views and your experience. So it's a win-win, I would say. But let me ask you a quick question. When you were asked by Mr. Buckley about whether children are safe, because that's the theme of this week's hearings, you said definitely not, or something along those lines, and you talked about how your mother was blackmailed, and you described how the doctors were putting the boots to her on this weaponizing your suicidal ideations, I think was how you described it. How one of your treating physicians ignored this myriad of overlapping and complicated and interrelating psychiatric and psychological landscape, which would have required some attention, but evidently didn't get that attention. They went straight to what might have been a fashionable or sort of an ideologically driven solution, if I'm not misstating your views on this. But then you also said this, you said, and the teachers pushing this stuff in the schools. Can you share with us what you meant by that? What are your observations and any sort of dealings you've had with respect to that subject?
Absolutely. So I've had different types of teachers my entire life. I've been friends with teachers outside of school as well, like not my own teachers, but just people who happen to be teachers. And seeing the types of teachers that people were 30 years ago versus the types of teachers I got versus what's in the schools now, they bring their own personal bias and their own personal lives into the schools way, way more now than they used to. Even when I was in school, but again, compared to 30 years ago, that's a completely different version of education at that point. And to have an educator bring in their own beliefs, like when I was in school, my teachers weren't allowed to even talk about if they were Christian or not. They weren't supposed to speak about their religious beliefs. But now you can have a pride flag up in your classroom. You can have all the genders up in your classroom. And it doesn't matter if it's Pride Month. That seems unprofessional to me in the loop. But to actively tell children to bring in pronoun pins, to let children believe that they're cats and can use litter boxes in your classroom or in the bathrooms of the school, that's a little too far. To constantly be demanding that your children, like your students, refer to you with they, them pronouns, and to think that you're not confusing these children when they're in preschool, that's ridiculous. And I didn't have to deal with that. I still found it on my own. But for a child to be exposed to it at such a young age, they'll think it's all just fantasy land. They'll think that pronouns are just these things you can exchange. They'll think your body parts are the same way, and they won't find anything wrong with this. And it's like, I would like to think that children should be taught that they're human, you know. But for a teacher to come in and just expect that, oh no, teachers are even using the litter boxes, you know. And it's just, that seems like you've gone too far as an educator.
Okay. All right.
But yeah, and that's just the minimal experience I have, unfortunately. But yeah.
Thanks very much, Faith.